Hello, we are live with Dr. Nancy on Wednesday and no technical issues today, so this is great. I'm very honored to have Dr. Bryce with us today. He's with the Brain Balance Centers here in Indianapolis, and I know a lot of you are familiar with them. They do some wonderful work, and he's here to tell us a little bit more about it. But first, I want to have him introduce himself to you and tell a little bit about himself. Welcome.
Awesome. Thank you very much. Thank you, Dr. Nancy. Thank you to your staff for having us here today. We're really excited to take a few minutes and kind of share, who we are at Brain Balance and what we do. My name is Bryce Lindley. I'm also a chiropractor. That's kind of my background as well. And getting into all of this, one thing that I was passionate about and I knew that I wanted to learn about was the brain. And that's kind of actually what got me into chiropractic, learning about the nervous system and removing interference there. And going down that route, eventually kind of got introduced to the idea of functional neurology and kind of got in and learned with some great mentors, which eventually led me to Brain Balance. So, there's actually a lot of similar roots between Brain Balance and chiropractic history. So our co-founder, Dr. Robert Melillo, he's also a chiropractor. He's got some other backgrounds as well. I like to consider him a mentor of mine when I was in school. And it was really learning as much as I could from him that got me really interested in this Brain Balance program. So I moved up here from Texas. That's where I'm from originally. So I'm up here fighting off the cold weather so I can help some families and serve some kids. At Brain Balance, we are a non-medical program. We work with kids as young as age 4 or 5, all the way up to about age 17. Really dealing with all sorts of different academic and behavioral and social issues. A lot of the families that we work with, they may have a kid that's greatly struggling, and they're looking for answers, they're looking for hope, they're trying to find anything that can give them some results. And a lot of our families, they've been down this kind of standard medical route. A lot of them have gotten the diagnosis and maybe even tried the medication or the counseling or tutoring and oftentimes what we find is that a lot of these kids, when there are some underlying issues that are holding them back in these different areas, that, they've tried some of those top-down approaches and just didn't really see the change that they were looking for. Mm-hmm. So here at Brain Balance, similar to chiropractic, chiropractic is all about removing interference in the nervous system, making sure that your brain has good connections to your body and vice versa. And that's kind of how I look at Brain Balance. What we want to do here at Brain Balance is make sure that there are no underlying factors that could be making these things more difficult for these kids. So I like to think of our program as kind of going backwards in development and making sure that these kids have all of those foundational skills that they need to develop the things up at the top, like social skills and academic processing and even things like behavior control. So we take a very different approach there. Like I said, a lot of our families, they have kids that are struggling, in school or with behaviors. And they're looking for answers. Now, oftentimes the school will kind of push them down the medical route. And, they want a diagnosis, they want medication. And a lot of our parents are coming in here because they don't want that for their child. They understand that, there's really no medication in the world that's going to solve these problems for these kids. Mm-hmm. There's times when that's necessary, but really any medication, all a medication is for is really to kind of manage the symptoms or kind of cover up some of those symptoms. Here at Brain Balance, we take a very different approach. We're not as concerned with managing symptoms or dealing with symptoms. We want to really get down to the root cause of what's going on and why these things are more difficult for them in the first place. So I know that you may not be able to see this very well, but I did want to show you a little bit of a visual here, and I hope you can read it some, and I can make these resources available to you guys as well. But one thing that we look at, we have this little pyramid here. And I think it gives a good representation. Whenever we show this to our families, the one thing that I tell them is the reason they're bringing their kid to us is really for reasons way up here at the top. When it comes to the brain and its synchronization, all being able to work together. This is where we find, academic skills and behavioral control and social skills. And that's ultimately why parents are bringing their kids to us. But like I said earlier, we're not a tutoring center, we're not a counseling center, we're not medication, we don't take that kind of direct top-down approach. Most of our kids have tried that and just didn't see the change they were looking for. So our program, like I said, we want to go kind of backwards in development and make sure that every kid that comes through here has all of these foundational skills developed up to an age-appropriate level so that we can see these huge changes up at the top. So, we're looking at things like primitive reflexes, that we're all born with, making sure that these kids have integrated or lost these primitive reflexes. I'll give you some examples if we have some time at the end. But then we're also working on sensory processing. A lot of these kids that may struggle with behavior, for example, they'll also have a lot of sensory issues. Certain textures or clothings may bother them, or certain foods. They may pick their foods based on how it feels in their mouth and not based on, what it tastes like or what it smells like. So, one thing that we do as far as our assessment goes is we're basically going through testing all of these different areas. And if we find things down here at the bottom that could be kind of holding them back up here at the top, that's our approach, is really go back, build that solid foundation for them so that ultimately we can see these huge changes at the top. Now, I'll tell you, taking this approach is very effective. We really expect to see about a 2 to 3 year improvement, each 3 months that we work with the child, pretty much throughout this pyramid here, including these things up at the top. But really what I like about it is taking this bottom-up approach is also why we expect these results to be permanent. Whenever we can really give these kids that solid foundation and really help them develop naturally these skills up at the top, then these are changes that we expect for them to have for the rest of their life and for them to actually continue to show improvement even after they're done with us here. So
what does a program pretty much look like? Like, what do you do there at Brain Balance?
Yeah, so that's a good question there.
Yeah.
So all of our kids, we always start off with an initial comprehensive assessment. It is about a 3-hour process, but it's very different than really any other assessment out there. Again, we're not sitting down and talking to them or asking them questions or, really looking at their academics. I mean, we're not concerned with the symptoms. We want to know how their body is functioning. So they come through, it's all very hands-on. It's a lot of objective measurements that we can compare to age-appropriate norms. So when we put all of our assessment together, we can really go through and test all these different areas of the brain and see how mature or how strong they are. And that's really what gives us answers. It's what's going to tell us, one, is this the right program for your child? Is this a developmental issue? If so, we would recommend the program, then we want to also tell you what specifically is going on that could be causing these symptoms in the first place, and give you some true answers. I have parents tell me all the time, when we sit down and go over all the results and I can kind of tie all of this together, it's like, wow, this is the first time someone's been able to explain to me like what's going on with my child and why they're showing some of these symptoms. A little bit more on my background, which I feel like is kind of what got me into this, was my sister struggled with a lot of these issues growing up, and my parents would have never put together the fact that, she had sensory issues, she didn't like to wear underwear or socks, those things bothered her. They would have never linked that up with the fact that she also had a lot of behavior problems at home, and struggled making friends and keeping friends and having relationships with family members. They were doing the best they could. They raised her, the best that they knew how, but it wasn't working, and she was going through challenges that I didn't go through, being her older brother. And it put a lot of stress on my family, put a lot of stress on their relationship. And if we would have had a program like this back in my hometown, we would have been able to get some real answers, I think it would have changed everything, not just for my sister, but for my whole family. And even this day, she still struggles with some of those issues. I've been able to help her a lot, but these kids, as they get older, they may learn to kind of cope with some of this, but it's still something that they have to deal with and something that they have to struggle with on a daily basis. And, my sister's a good example of that, which, kind of brings me, to another point there of, again, whenever we are sitting here trying to address the underlying issues, our goal, nothing that we do here in our program is about coping with these problems. We're not, whenever a kid graduates from our program, we're not giving them the tools to just deal with it better. We want some true resolution. We want to actually address these underlying causes to where when they graduate, it's something that they no longer have to deal with or have to struggle with. And they can continue to move on and develop, age appropriately there. So good question.
Yeah. And then the chiropractic part of it, you guys, do you do the adjustments at Brain Balance, or do they usually have a chiropractor?
Yes. So I recommend, I wish I could adjust all of my families and all of our kids. I'm a huge proponent of that. And I love keeping my hands busy. But we do not do any adjustments here since we are a non-medical center. It just doesn't really fit with what we do here.
Yeah.
We have a very niche program, a niche company here. So I recommend all of my families, especially all of our kids, are also working with a chiropractor locally, so that they can also make sure that they don't have any interference in their spine, or in the rest of their nervous system. I like to think kind of our program, or a functional neurology, is kind of like we have chiropractic ideals and philosophies, but we kind of focus above the atlas.
Yes.
And don't focus so much on the spine, which is also extremely important there.
Right.
So definitely some common themes there, and it works perfectly hand in hand together.
Yeah, some of the patients I've seen with the two in my office where they've had brain balance along with the adjustments, they've really excelled well in your program. So I've seen the two work really well together. So
yes, I mean it's key. Our program is pretty comprehensive. We don't adjust in here, but we do cover a lot of home environment aspects as well. We're not a nutritional program, but we do have nutrition as a component of our program, because it's very, very important to make sure that the kids that are coming to us, they have good fuel, for their brain, so that all the stimulation that we're giving them in here, that their brain can actually utilize that and grow from it. So we do have nutrition as a part of our program. We have home exercises, so that a lot of these things that we want to address as quickly as possible, we can also implement that at home. Because really, when you look at these issues, that these kids are struggling with, whether you're talking about ADD, ADHD, dyslexia, even through like the autism spectrum, the rates of these diagnoses are going up, every single year. I mean, Dr. Melillo in his book, Disconnected Kids, it was one of the first books that he wrote, which also explains a lot about our program and what we do here. He goes in and talks about a lot of the factors. And at Brain Balance, we try not to focus too much on figuring out exactly how we got up to this point, because really there's no way for us to give specific answers there. Our main focus is what's still going on today that could be affecting and holding these kids back in certain areas, and what do we want to do moving forward to change that. But to kind of hint on that, because it is a very interesting conversation. I mean, it's really, the way I could simplify it is it's the same environmental factors that are leading to, rising rates of obesity and heart disease and cancer and diabetes. It's these same factors that are not only giving us imbalanced bodies, they're also giving us imbalanced brains, and it's affecting our kids at young ages. And this is really kind of the future. We have to deal with these neurological disorders, whether you're talking about developmental disorders, which is what we really focus on here, or even like neurodegenerative disorders, kind of in the older populations. These are things that, the common medical mainstream doesn't have a lot of answers for these kids. And it's going to be programs like Brain Balance that are taking a much more holistic, natural, and functional approach that are going to be necessary moving forward to really, really resolve these issues.
Yes, I agree. Yeah.
So we see, all sorts of different diagnoses and labels. But again, our goal is not to give that label. Our goal is to change that and really give some resolution there.
That's great.
Yeah.
Well, I think you're doing some wonderful things. Helping the kids naturally is always the goal in my mind.
Yeah.
So I appreciate you, coming on today. And then you do have a special announcement to give today.
Yeah, definitely. We're really appreciative of your time and letting us on here. So we did want to give a little bit of an offer for anyone that calls in and mentions Dr. Cooper's office or this video. We always do free consultations, so any family is welcome to schedule a free consultation and come in, and we can talk a little bit and go over some of this information. But really, for all of our kids, the first major step is to schedule a comprehensive assessment where we can actually get some results, and let you know what's going on and if this is the right program for your child. And we're going to offer half off for that for anyone that mentions your practice or this video. So that could save you about $150 there to go ahead and get some answers and get some results.
That's very generous. I mean, for a 3-hour exam, that's very reasonable. So thank you for offering that to everybody. For us.
You can always, anyone can give us a call. We have an office. The number up on the north side is 317-843-9200. And then down on the south side near Greenwood, we have an office down there as well. And that phone number is 317-497-8166. So you can reach us directly there, and we can pull out the schedule and see what works in your schedule as well.
Great. Thank you so much for joining us today. I really appreciate it. Great information. I totally support this program. I think it's a great thing. I see a lot of this in my office, and I wish I could incorporate it all, but I can't. So I just really want to just get to the adjustment part and let professionals like you do the retraining of the brain. So thank you again.
Thank you.
All right. Have a great day.
All right. You too.